you know that I'm passionate about the new patient experience. And you happen to be one of those people that might be as passionate as I am about the new patient experience.
Thank you.
And not everyone has that passion. I get it, but you do. And in that way, I kind of feel like brothers, like brothers from a different mother. But I know you're passionate about the new patient experience. Can you talk about what that means and what you've done in your practice to try to create a new patient? And I think it's still a work in progress, as it is in ours. We're always going to get better. But I think of your office as having a really solid new patient experience. Can you talk a little bit about that and what your perspective is on that, and what are your thoughts about that?
For sure. Yeah, I couldn't put it, any better way, Gary. That's the number one thing that starts an experience, just like Dr. Paul did with that lady. I mean, he really made that first impression just such an impactful impression, and from there it just opens up opportunities. So, I've often heard you say that the most important piece of machinery in the entire office is the phone, and it's not a drill or my new CEREC machine or anything like it. It's the phone.
And you have some enviable technology that we're going to talk about, but you're absolutely right. That simple telephone may be our most important piece of equipment.
Starts with that, yeah. So number one, we have that new patient concierge that really takes the time, really connects and starts the relationship process with that prospective patient. And it turns that prospective patient, I mean, it could be as simple as they saw our website or something like that, or, saw some Google reviews or whatever. But they're not committed yet. They're still assessing us, they're checking us out and seeing if we're the feel that they're looking for. And so that new patient concierge, it always kind of funnels through that person. And then they take the time, they know what questions to ask, they know what message to deliver to make sure that the patient knows that they're welcome, that we love new patients, and you're welcome here. And so we get them in quick. And that takes effort. I'll put it this way, before I met you, to be honest, I mean, it's for decades, probably. I've always wanted to do this. And it wasn't until kind of conversations with you and kind of learning some skill sets that you talked about to really prioritize this desire that you wanted. Don't just make it a desire, make it happen, and block out spots and make sure that you will get that person in within a few days.
Okay. I want to park on that for a minute, Chris, because I believe that this is the Achilles heel in many practices, many very successful practices. From working with me that we teach a system with new patients. And let me define what I'm talking about by the new patient too. This isn't an emergency patient in pain. I'm talking about someone that maybe recently moved to the Seminole area, and maybe in the process of unpacking, they got to know their neighbor, and they asked their new friend, their neighbor, hey, I'm going to be looking for a dentist. Can you recommend anyone? And that neighbor recommends your office, Chris. And now that person calls and says, hey, I just moved to the area and I want to get established with a dental practice. I'd like to make an appointment. So that's what I'm talking about. Not anything that's urgent or hurting. And that I teach a system where ideally I want to get that patient in, ideally in no more than 3 business days. So if it's Monday, I want to get them in before, say, Friday, if possible. And I will stretch that and say in times where our schedule is really crunched, I'll flex that and make it a week. But beyond that, and I think if we can't accommodate a new patient within a relatively short period of time, you're really not rolling the red carpet out to welcome new patients to your practice. And can we agree, Chris, that's not always easy?
Oh, it's very difficult. It's very structured. It has to be structured. It has to be your number one thing to do is make sure you have spots and ways to maneuver to get these patients in. It's they want hygiene. They want to get their cleaning. And so if you don't accommodate that in some way, it doesn't mean it necessarily says they will get in that day. It can be as simple as saying, hey, it's very easy for us to accommodate you. We are very good at making sure that we will get you in within a few days. And so it doesn't mean they will get in. It just means that you give the message that you will make it happen.
You're rolling the red carpet out.
Right. For months, I mean, for years, I had heard my front desk just in passing, Oh, well, about 6 months is our first appointment. And in my mind, I'm like, no, that's horrible. That's not the way to do it. And so, but it wasn't until you became structured to actually inform the person that's taking the calls exactly what to do, exactly the verbiage to say, exactly the structure of the VIP list, the ASAP list, whatever, to make it happen. And then to block out appointments so that it's not just, goes to the end of the line of whenever you're blocking things out. So, yeah.
And I love the language that your team uses. We love seeing new patients.
Oh, yeah.
You called the right office.
Mm-hmm.
It's
Right.
great to meet you. It's great to meet you by phone. I can't wait to meet you face to face. Those are the kind of things I hear. I've listened to your phone calls. Those are the kind of things I hear from your office. But you do a really good job. Technically, just for our listeners' benefit, we use a block system for new patients where we put blocks in the schedule, and we reserve those for new patients. And you could have those technically. Here as the time we're recording this, it's December of 2022. Chris, you could have blocks for new patients for the entire 2023 calendar. Now, if we go out in the second half of the year, you're not going to have any patients in there yet, but we're going to have the blocks in there. Right. And then you manage those blocks. We use a 48-hour release. So if we don't fill it with a new patient, then we release it 2 days before. And that allows us to fill it with something. So we're not going to be sitting around. But that block system, when it's managed well, really becomes your solution to roll the red carpet out and be able to accommodate a new patient relatively quickly.